Hello everyone. Welcome to my channel. My name is Jordia. I am a registered nurse, Filipino-American, OFW, a traveler, and founder of Care to Heal. This video is brought to you by Care to Heal. Please support my channel so that I can continue creating educational videos like this. Please like and subscribe below. In this video, we will talk about tips in remembering the basic patient's assessment. Let's understand why when you go to a clinic or hospital, staff keeps on asking you over and over the same questions. For any healthcare provider, particularly the nurses and doctors, it is vital to do client's assessment before any treatment can be implemented. The plan and management of care for a patient can be customized according to their needs and results of assessment. Assessment plays a critical role in all patients crafting personalized plans to develop care plans that respect the wishes and cultures of the patient. It also bridges the gap between theoretical knowledge and practical application of all healthcare professionals. In all clinical settings, ensuring a people-first approach in patient assessments are essential and will always be the first stage of any appropriate treatment plans. The patient's subjective and objective observation confirms any patient assessment. Along with these observations, the cardinal vital signs must be checked. These are the body temperature, pulse rate, respiration rate, blood pressure, and pain scale score. What are the step-by-step guide to conducting a basic patient assessment? In preparing for any patient's assessment, collection of all the equipment and patient engagement are necessary. The nurse's observation skills such as visual, auditory, and tactile evaluations are some of the basic assessments. The second most important step of assessment is effective communication. It is a key to accurately collect the medical history of the patient. All these assessments must be documented in the patient's chart. In my personal assessment practice, I always think and compare my patients to a tree. The tree and patient comparison goes like this. Tree leaves are the patient's body hair. The tree branches are the upper extremities. Trunk is the patient's body, barks are the skin and nails. Finally, the tree roots are the lower extremities. Most of the time, proper assessment helps in early detection of health complications and timely intervention. The patient's assessment gives a clue and idea to the healthcare provider, and they can identify the possible presence of contagious or non-contagious diseases. It also helps to monitor the daily condition of the patient, progress or deterioration. How about doing a comprehensive nursing assessment? How subjective and objective nursing assessment works? The first type of assessment is the subjective nursing assessments. These are an essential part of the nursing process, focusing on information that is expressed by the patient, or their family/caregivers, about their feelings, perceptions, and self-reported symptoms. This type of data is crucial for a holistic understanding of the patient's condition, as it provides insights into how the patient is experiencing their health issues, which might not be immediately apparent through objective measures alone. Here are the key components of subjective nursing assessments. The chief complaint or the primary reason for the patient's visit or care, usually stated in their own words. 3. This gives the healthcare provider a clear focus on what the patient perceives as their most significant health issue at the moment. Next is the history of present illness. A detailed account of the development of the patient's present illness, from the first sign or symptom to the present. It includes the onset of the problem, its duration, intensity, frequency, symptoms experienced, and factors that alleviate or exacerbate the condition. Past medical history includes any previous illnesses, surgeries, hospitalizations, allergies, accidents, and treatments. This component also covers chronic conditions, immunization status, and use of prescription medications, over-the-counter drugs, and dietary supplements. Next is the family history. Any information about the health of immediate family members, focusing on conditions that may be hereditary or place the patient at risk. Now, the social history. This encompasses the patient's lifestyle, including employment, living conditions, level of physical activity, diet, use of tobacco, alcohol or other substances, and sexual health. 2. Social support systems and cultural factors are also considered here, as they can significantly impact health and well-being. So what about the review of body systems? A systematic approach to collecting information about past and current health issues related to each of the body's systems. 2. Patients are asked about symptoms related to the gastrointestinal system, cardiovascular system, respiratory system, neurological system, musculoskeletal system, endocrine system, and more. 3. This comprehensive review helps to uncover problems the patient may not have initially mentioned or considered relevant. What about the pain assessment? If pain is a complaint, a detailed assessment using the patient's own words to describe the pain's location, quality, intensity, often using a scale from 0 to 10, timing, duration, factors that cause or relieve it, and its impact on activities and mood. The emotional, mental, and psychological assessment is evaluating the patient's mental status, emotional well-being, and psychological state is vital. This can include assessing mood, anxiety levels, presence of depression symptoms, stressors, and coping mechanisms. Functional assessment is gathering information on the patient's ability to perform activities of daily living, ADLs, such as bathing, dressing, eating, and walking. This can extend to instrumental activities of daily living, IADLs, which are more complex skills like managing finances, transportation, cooking, and medication management. The second type of assessment is objective nursing assessments. These are a critical component of the nursing process, providing a structured and systematic way to collect and analyze data about a patient's health status. Unlike subjective data, which relies on a patient's self-reports about how they feel or what they are experiencing, objective data is based on observable and measurable signs that can be seen, heard, felt, or measured using instruments or diagnostic tools. This data is crucial for making accurate diagnoses, planning care, and evaluating the effectiveness of interventions. Here are some key aspects of objective nursing assessments. The vital signs. Temperature is measuring body score temperature. Next is pulse, assesses the heart rate and rhythm. Respiration observes the rate, depth, and effort of breaths. Blood pressure determines the force of blood against artery walls. Oxygen saturation measures the percentage of hemoglobin saturated with oxygen. Physical examination is inspection, looking at the body for any changes from normal. Palpation, feeling the body with hands to assess the size, consistency, texture, location, and tenderness of an organ or body part. Percussion, tapping on a surface to determine the underlying structure. Auscultation, listening to the sounds made by internal organs, such as heart, lung, and bowel sounds, typically using a stethoscope. The diagnostics tests are blood tests, to check for conditions such as anemia, infection, and many other disorders. Urine tests, to screen and diagnose urinary tract infections, kidney disease, diabetes, and more. Imaging tests, such as X-rays, MRIs, CT scans, and ultrasounds, to visualize internal structures. Electrocardiogram, ECG or EKG, to record the electrical activity of the heart over a period. Neurological status. Level of consciousness, LOC, including alertness and orientation to time, place, person, and situation. Pupil response, checking for size, equality, and reaction to light. Motor function, assessing strength, coordination, and balance. Mobility and function are the range of motion, ROM, is the movement of potential joint. Muscle strength is testing the power of a muscle or group of muscles. Gait analysis, observing the manner or style of walking. Next is skin assessment. The integrity is looking for breaks, dryness, or infection. The color is noting pallor, cyanosis, jaundice, or erythema. Temperature is assessing warmth or coolness. Turgor is checking elasticity by pinching the skin lightly. Depending on the patient's condition, other specific assessments may be necessary, such as assessing fluid balance by measuring intake and output, evaluating the effectiveness of interventions, or performing targeted assessments for symptoms related to specific conditions. Objective assessments form the basis of the nursing care plan, providing vital information that, when combined with subjective data, offers a comprehensive picture of the patient's health status. This integrated approach ensures that care is patient-centered, thorough, and tailored to meet individual needs. Integrating subjective and objective data. The combination of subjective and objective data enables nurses and healthcare providers to form a comprehensive understanding of the patient's health status. This holistic view is crucial for developing an effective care plan that addresses both the physical and psychosocial aspects of the patient's condition. Listening attentively to the patient's subjective experience fosters trust and rapport, which are foundational for a therapeutic nurse-patient relationship. Let's sharpen your assessment skills. Put in mind that regular assessment in nursing practice is mandatory. It affects the flow of decision-making for treatment adjustments and enhancing patient safety. The effectivity of treatment and the quality of care through comprehensive evaluations depends on each client's condition. Yes, nursing is a continuous learning. We keep up to date with best practices in patient assessment. The critical thinking and clinical judgment in interpreting assessment data are the key components of all successful management of care and treatments. Assessment and history taking can emphasize the empathy and cultural sensitivity in patient interactions. The nursing education and school programs must put leveraging feedback and reflections to improve assessment techniques. We can only hope that all the nursing schools may put more attention into strengthening frameworks of the nursing curriculum assessment subjects. I hope you enjoyed this video. I highly appreciate your time and comments. Every comment will help me improve the content of my videos. For faster delivery and medications need, please visit caretoheal.org. Thank you for watching and see you in my next video. Please click like and subscribe below.